Hello, thank you so much for having me speak to you today. I feel honored to be here to present to all of you. My only disclosure is that I am the medical director of Aeroflow breast pumps. I have three objectives for this talk. The first is to understand the significance of the fourth trimester in maternal and newborn health. The second is to discuss initiatives to improve breastfeeding and fourth trimester support for mothers of term and preterm infants. And the third is to learn about current trends in newborn and infant care in the community. To give you some background, I'm going to tell you my story, starting as a pediatric resident at UMass. During my residency, I knew that I had two possible future pathways. The first was neonatology, which I had been introduced to as an undergrad. One of my favorite professors at Notre Dame, Dr. Robert White, was a neonatologist and also became a mentor to me. The second path was to have my own pediatric urgent care center in a van. Many people who I shared my van plan with thought I was crazy to want to do home visits. I ended up becoming a neonatologist, obviously, but I've had the idea of owning a pediatric van tucked away since then. The most important and impactful part of my pediatric training was having my first baby Grace during my third year of residency. Between being the oldest of 5 kids, babysitting on a regular basis since I was only 11 years old, and my training in peds, I felt I was as prepared as possible to become a mom. What I did not anticipate was the reality, and I didn't ever imagine that Grace and I would become a mother-baby breastfeeding failure. Essentially what happened was that she was born healthy and full term, and she had problems with latching while we were still in the hospital. My milk was pretty delayed in coming in, and Grace had excessive weight loss. I think she was close to 12% below birth weight when we left the hospital. Because of this, she became jaundiced, and I had to start to supplement her with formula. And shortly after having her first formula supplementation, she had actually projectile vomiting and bloody mucousy stools. So at this point, I was still trying to breastfeed, and we changed her supplemental formula to Alimentum. But because it seemed like she did so much better when she drank my dairy soy-free breast milk than the formula, but my milk supply was low, we ended up in a triple feeding cycle. And so what triple feeding, for those of you who don't know what that is, it means that I would put her to my breast and try to feed her, sometimes with a nipple shield, sometimes without. And then after the breastfeeding attempt, I would give her a supplemental feeding by bottle. And then at that point, I'd have to pump because I hadn't fully emptied my breasts when I was feeding her. And then about an hour and a half to 2 hours later, we started that cycle all over again. And I did that for quite a while. Despite that, she was below birth weight when she was 1 month old. Then she started to have a recurrence of vomiting and unusual poops after Alimentum. And she was still refusing to latch. And I was still triple feeding. And I really hadn't slept for about 8 weeks' time. And I look back, the reason I kept on doing all of this is because I think I worked with 3 different lactation consultants, and everyone kept telling me breastfeeding's hard, wait, you guys will get the hang of it. Someday it's just gonna click. And I'm not usually a person to give up on things, so I just kept on trying. But what happened was not good. I ended up developing postpartum depression. And just a few days after this photo was taken, just after a unsuccessful nursing session with Grace, bear in mind I had not slept for 2 months' time at this point, I almost jumped out of a 2nd-story window trying to take my own life. I did not know at the time, but retrospectively looking back, I can see that I was a perfect setup for developing postpartum depression. And as you can see on the right, I had numerous risk factors. I was a first-time mom. I had no family nearby to help because we were away from our families for residency. I did have an element of a traumatic birth. We had breastfeeding problems, obviously. My maternity leave was relatively short since I was a resident. And as I described earlier, I had about 2 months of really not sleeping. I was fortunately able to get in with psychiatry at UMass really fast. And I was started on an SSRI. And around that same time, I just totally weaned and stopped breastfeeding and pumping so that I could start to rest. Grace and I were both healed up pretty fast. And this was, we were doing great at the beginning of my fellowship, which was the next summer in 2006. And then the second photo was from Grace's confirmation last summer. As you can see, she's actually taller than me. And then also to follow up, I had 3 children after Grace, and my postpartum depression never recurred. And I was much more successful breastfeeding my youngest 3 kids. Since my experience with Grace, I've met a ton of moms who've had a similar postpartum experience to me. So it seems like both postpartum depression and breastfeeding problems are unfortunately still very common. And this table was from the Anxiety and Depression Association of America and shows how common perinatal mental health disorders are. So you can see it's about 13% of women in the US experience postpartum depression, 3 to 5% OCD, and 9% postpartum anxiety. This list, which is from the website for Postpartum Support International, has the most common symptoms of PPD. And several therapists and mental health specialists who I've met over the last few years have really emphasized that the inability for a mother to sleep or rest when the opportunity arises, so like being able to sleep when baby is sleeping and there's no other responsibilities to tend to, is one of the biggest red flags that either postpartum depression and or anxiety is going on. There was a recent publication looking at rates of both postpartum depression and anxiety pre and post COVID. And this slide's very sobering. This paper, which is out of Calgary, Alberta, was just published in December, so last month. And it's pretty remarkable. You can see the baseline rates of postpartum anxiety prior to the pandemic. And they surveyed, I think it was about 2,000 women, and over 50% met criteria for postpartum anxiety. And the same holds true for postpartum depression. Pre-pandemic, you know, they have 10%. It's somewhere between 8 to 15% in any given year. And here are the rates, again, during 2020, in these 2,000 moms up in Canada, were close to 40%. This table is from a recent study of almost 600 first-time breastfeeding moms of healthy term babies in Milan, Italy. And overall, the article that it comes from, the researchers found that at least 2/3 of the moms they surveyed had one major breastfeeding or lactation problem. And that in almost all cases, these problems were in the first 4 weeks postpartum. And I was actually fortunate to meet a few of the main researchers from this group at a breastfeeding conference in 2019. And they're investigating the link between breastfeeding problems and postpartum depression. And so there should soon be some really solid, good research in regards to this relationship. I did a comprehensive review of the problem of breastfeeding failure, and I found all of the alternate names in the list. I'm not going to read all of them off, but as you can see towards the bottom is the term lactastrophe, which I found on a online forum that's for physicians who are interested in breastfeeding medicine. And I like it because I think it perfectly describes what happened to me and Grace. We definitely were a lactastrophe. The best definition of lactation failure comes from Ruth Lawrence, almost 35 years ago. She's a pioneer in breastfeeding medicine, and she is also the founder of the Academy of Breastfeeding Medicine. And as you can see, there's 3 parts to lactation failure. The first is it's a failure to produce a minimum amount of milk. The second is failure to thrive. And the third is failure of the mother to achieve her preset goal for duration of lactation. This is a little bit busy of a slide, but I'll walk you through it. It's important. And again, this is research that's been done by Dr. Lawrence and Marianne Neifert and some other breastfeeding medicine physicians. But we now know that there's about 5% of moms that have primary insufficient lactation because they have something inherently anatomically wrong with their breasts. So like insufficient glandular tissue or breast hypoplasia. Or there's some very serious medical illness that makes them unable to produce a full milk supply despite, quote, heroic efforts. So that's 5% of moms. But what we know is much more common is that there is a huge link between delayed lactogenesis 2, which affects about an additional 5 to 15% of moms, and being unable to exclusively breastfeed. And as you can see, this list on the left, which is from some research done by Medela, shows all of the common risk factors for delayed lactogenesis 2. So you really can take this list to extrapolate that moms and babies in these situations are all at higher risk of being unable to exclusively breastfeed, especially without proper support. Although this overall, so far, I hope that I have showed you that the rates of postpartum depression and breastfeeding problems are relatively high. The fourth trimester paradigm focuses on the importance of the first few postpartum months as a critical time for mother-infant bonding, establishing breastfeeding, and maternal recovery from childbirth. Who invented the fourth trimester? Although both Harvey Karp, the Happiest Baby on the Block author, and Kim Johnson, the author of a book that's actually called The Fourth Trimester, have taken credit for the term. The term fourth trimester was actually coined by Sheila Kitzinger, a British social anthropologist, back in 1958. And as you can see, highlights from her statement are that this is a time when women are emotionally highly vulnerable, during which anxiety is normal and states of reactive depressions are commonplace. The fourth trimester concept has really been put on the map the last 5 to 6 years by Alison Stubbe, MD, who's an OB-GYN and a lactation expert at UNC Chapel Hill. She founded the multidisciplinary Fourth Trimester Project, which focuses on research and advocacy for new moms and babies and reducing health disparities. And there's a lot on this slide. I just wanted, this is from one of the Sentinel Fourth Trimester Project publications. But she really talks about how multiple issues intersect during this fourth trimester: maternal mood and emotional well-being, infant care and feeding, sleep and fatigue, physical recovery from childbirth. And that by comprehensively addressing these needs, service providers can improve health and well-being across 2 generations. ACOG referred to the significance of the fourth trimester in their 2018 policy on redefining the postpartum visit. There had been a lot of media buzz surrounding this publication because what it's best known for is it's when the recommendation was made to move the first postpartum visit from 6 months to just, 6 weeks postpartum up to 3 weeks postpartum. And from this ACOG statement, they emphasize that postpartum care should be an ongoing process rather than a single encounter, with services and support tailored to each woman's individual needs. So where do new moms get their information and support nowadays? Based on what the moms I have talked to and what I have seen online is that a lot are getting most of their support in the rabbit hole of the internet. And this post was taken from a very big Cleveland public mommy group that was on Facebook just a few weeks ago. And you can read through the whole thing, but essentially it's a new mom looking for help. She's telling everyone her baby came earlier than expected. Baby has been fussy, and it looks like she's got a low milk supply, so she's supplementing with formula. She's asking if she's making the formula correctly. She's adding 2 scoops per 4 ounces of water. She also shares that her baby is gassy, and she's wondering if anybody has used gripe water. She has questions about if she should swaddle all day or just during naps, and how to manage the pacifier. And then at the end, she says, if you have any tricks that helped with your newborn, it would be appreciated. So I have, knowing all that I know and being so far out from having my own kids, I myself got overwhelmed with all the advice she got, and some of it was conflicting. So again, she's told it's normal for breastfed babies to go 10 days without pooping. But problem is we don't even know how old her baby is. Like, is this a 1 week old? It might be cluster feeding. You should swaddle nightly. You should do a warm bath after feeding. To avoid dairy, to avoid soy, to avoid cauliflower, asparagus, and Brussels sprouts. Have his doctor check for poop in his blood. Then another mom says, this is totally normal. It's just his changes in gut flora. And then this mom gets pretty graphic, talking about, she says, like, slightly spread their butt cheeks to the point where the anus has more space for the poop to get out. She has Nylacon drops recommended, the Frida Baby Windy, and then change the formula to soy. And again, bear in mind that this is for what sounds like a premature baby, so really not appropriate. This meme was recently shared by my friend Megan Gray, who's an obstetrician at Winnie Palmer Children's Hospital in Orlando. And she's author of this book, The Forgotten Trimester, which is a great resource for new moms. But the meme, I think, can really apply not just to the postpartum period, but all stages of parenthood, even at the school age stage that I'm in right now. So a few years ago, before I returned to Rainbow Babies in 2017, I started to dream about having a pediatric medical practice out of a van again. Only now that I'm a neonatologist, I figured that I'd have to focus on newborns and infants, since it's my area of special of expertise. So I searched around to see if there's any other physicians doing newborn home visits on a regular basis. And I found two. The first is Monarch, which is a clinic for moms and babies up in Ottawa, Canada. And although they have a large freestanding multidisciplinary clinic with OBs and pediatricians and lactation consultants, they do send pediatricians into the home for newborn well visits. And then the second is Tova Health, which was founded by a family practitioner in Boston named Eva Zasloff in, I think, 2015. And she provides all medical care to both moms and babies for the fourth trimester in the home. And it's just coincidentally, she lives in my husband's hometown in Massachusetts. So I've actually been able to both talk to her by phone, and then we were able to meet one time in person too, so that I could pick her brains about everything. So I decided to start up a small newborn medicine home visiting practice back in 2018. And just briefly, the steps involved in doing this included all of the following: having an idea and doing market research so that I can make a business plan. And then I filed for with the state of Ohio for an LLC, and with the IRS for an employer identification number. I had to search for malpractice insurance, totally separate from my malpractice at Rainbow, to cover me for my newborn medicine practice. I consulted with a lawyer and an accountant. I had to figure out how to document what platform to use for telemedicine. Then I had to do marketing, working on a logo, branding, and a website, and then networking, which is an ongoing process. But I networked all over the Cleveland area with all of the birth workers and doulas and midwives, and then pediatricians and OBs and postpartum doulas. So it's been a lot. You need patience with a CE. You need patience with a TS, and a willingness to take risks, be criticized, and possibly fail. And this was really hard for me because I'm pretty type A, and this is just not how I am wired, to take risks, be criticized, and possibly fail. This is the website for my practice, which is called Primrose Newborn Care. And I was able to just add the IBCLC after passing the lactation board exam last fall. And the reason I called it primrose is primrose is another word for first rose. And they were the sacred flowers of Freya, who was the Norse goddess of love. And in the ancient Celtic world, mothers placed primroses on their doorsteps to encourage fairies to bless their homes and families. And it's also a symbol throughout history of kindness, tenderness, nurturing, eternal love, first love, safety, protection, and womanhood. And I thought all of those words encompassed what it means to be a mom. This is a photo of all of the equipment that I bring to every home visit. And now that I'm an IBCLC, I also bring more breastfeeding supplies like nipple shields and breast pump flanges, and usually have a Haka with me and things like that. And this is a photo of me in action that was taken in early 2020 before the pandemic hit. And I know it was before the pandemic hit because I now wear scrubs and an N95 and disposable gloves for every encounter. And this is in brief, this is just a graph of every year, 2018, 2019, and 2020, the numbers of inpatient visits and telemedicine visits and total visits that I have had. So you can see that there's been just some gradual growth. This does not account for all of the phone visits and text message exchanges, and there have been many more smaller visits, but these are all visits that were comprehensive enough that they were considered to be a full visit, usually at least 35 to 40 minutes. I presented abstracts of my data on visits for 2018 to 2019 at the Academy of Breastfeeding Medicine conferences. I'm going to put a plug in for anyone who's interested in breastfeeding and lactation to consider joining ABM because it's a global community of doctors. We come from neonatology, pediatrics, OB, family practice, and there's just a wealth of resources out there to learn about lactation, to be able to network, ask questions, and then be able to do cool things like present your home visiting business. So this is my poster from the 2019 conference in the UK. And then this is the poster that I presented just last fall, talking about like my first full 12 months in practice. And I'm happy to share in greater detail any of this after I'm done with my talk. This is a word cloud of the most common reasons for my visits in 2020, which was inspired by one of my kids. And I think I want to emphasize before I go on that my goal with having Primrose is to fill gaps in pediatric care for newborns and infants and provide support to mothers, but it is not to be their primary care provider. And I'm going to demonstrate that in this handful of case studies that I have coming up that I'm going to share with you. Case number one is that of a 7-week-old full-term female, and this was last winter. Her great aunt and uncle had taken emergency custody of her late Friday night because their niece had serious substance abuse issues. They knew that they were going to be getting custody of her, but she ended up being dropped off to their house like several days before they had anticipated or thought. So when they were dropped off, I think I literally left her with diapers and some formula. I had no other supplies, and they didn't even have her medical records yet. They just knew that her pediatrician had been in Stark County. So the next morning she woke up and baby had nasal congestion, some mild retractions, and really wasn't taking her bottle well. So her great uncle called me that Saturday around 4 p.m. To please come and see her because he didn't know, it had been so long since he had taken care of his own kids because he was like 60 years old. And him and his wife didn't know if this was serious enough to go to the ER. They didn't have a pediatrician they could call. None of the pediatric urgent cares, were open at that point. And so I came over, and she did have what I was able to do, a head to toe exam, take her vitals, take her pulse ox, kind of talk through, well, how much is she actually, drinking with each bottle. And I diagnosed her with a milder case of bronchiolitis. And with frequent check-ins, Saturday night, I came back to see her on Sunday, talked to them a couple times on Sunday night, and then I was able to help them get a pediatrician so that she could be seen and established. And she was seen that Monday morning and was doing a lot better. Case number 2 was recently, this was in the last couple of months. This mother was recovering from a C-section at home, and she had nobody to help her outside of her 11-year-old daughter. So she was taking her baby out of the home for the first visit to the peds office. So the baby was like 5 days old at this point. But she fell on ice and slipped in the parking lot. So they never made it to the visit. So I got called on when the baby was 7 days old. She told me what has happened, and she said she was just so scared to leave the house. She didn't want to fall again. So she asked me to come and see the baby. So I did. And fortunately, the baby's weight was okay, and jaundice was okay, and breastfeeding was going well. So I was able to help her get established with a pediatrician down in Twinsburg. The third case was I was called for a 1-month-old male who was coughing and gagging during every breastfeeding session. And I think mom had been working with her pediatrician, and he was actually scheduled for an outpatient upper GI like several days down the road. But mom called me because she just didn't know what to do. And she said she had hit a point where she was just scared to feed her baby because he was coughing and gagging. So I was able to come over and talk and examine him, and I watched her feed. It was pretty clear, piecing everything together, that the main problem we were dealing with was a breast milk oversupply. So at this point, we consulted with Dr. Ann Witt at Breastfeeding Medicine of Northeast Ohio, just to be able to chat through what was going on with her. And all of the baby's symptoms resolved with block feeding and just nursing in more of a laid back position. And her supply totally normalized, and he never needed the upper GI. And they went on and did really well. I kept in touch with this mom for a really long time, and at a year, she was still exclusively breastfeeding. I mean, not exclusively breastfeeding, but she was still breastfeeding. He was getting solids. Case 4, I got a call, this was about 6 or 7 months ago, from a home birth midwife that a 2-day-old infant she had delivered was vomiting blood, but otherwise looked okay and in no distress, and that the family was refusing to take the baby to the hospital for an evaluation. So this was a tough one to decide what to do. I opted to go and see the baby because I was actually really worried, like, gosh, what if this, is an emergency of some sort? And I went and talked, and what ended up, the piece of information that they hadn't told me was that mom during the home birth had probably a small placental abruption, and that this baby indeed had swallowed a bunch of blood. So I was able to examine her. We talked through that history, and we were able to, mom and dad did agree, I think 2 days later, they took the baby to a pediatrician and established with a pediatrician out in Geauga County. And the case 5 was also last winter. I had a mom of a 3-week-old reach out to me because she was having a hard time getting her baby on a schedule. She wanted her 3-week-old exclusively breastfeeding daughter to have like a very regimented schedule of sleep, wake and play, feed, and sleep. And I talked to her by phone just about, you've got to have realistic expectations, and this is not developmentally appropriate. And she asked me to still come over, so I did. Baby was totally fine. But what she shared with me during the visit was she really felt she was at her wit's end, that she was getting depressed, and that she was having a really hard time. She had tried to call different psychologist offices, and she couldn't find anybody who could meet with her because it was the holidays. It was like the week between Christmas and New Year's, I think. And she was very professional. She was an attorney, very polished and put together. And she had hesitated to reach out to any family or friends just because she didn't want to seem vulnerable or like she didn't have her act together. So I was able to help her through the back end, get her quickly seen for a telemedicine visit with one of the psychologists at the UH Center for Women's Mental Health. All right, So just to switch gears a little bit, I just have shared with you some of what I've seen going on in the community over the last few years. And I do get asked a lot of questions about if there's certain trends in the community that I've seen, and I have seen some. So I wanted to share a few. The first is that home births are booming. Anecdotally, I can tell you that there's been a significant increase in home births since the pandemic started. I don't have 2020 data. The last published data I could see was actually that in Ohio, there are about 1,500 home births every year, and 8 out of 10 of those home births are planned ones. And when you look at our Ohio data compared to other states, we actually have a lot of home births for our population. I have learned that some of the lay midwives delivering at home are also acting as the pediatrician. And so they're kind of bundling in a couple months of well baby care into their clients' home birth packages. And then in the middle this is a home birth midwife who's here in Northeast Ohio. And she's specifically specializing in being skilled to help with high-risk deliveries at home, such as twins, VBAC, and breech. From the few, like the one case that I shared with you of the mom with a small abruption at home, and some other people that I have talked to, it's pretty clear that a lot of parents are really receiving insufficient counseling of the risks of home birth. The second kind of related thing is that it is very in fashion to save your placenta. And it's not only to make it into placenta capsules, which are believed, if a mom ingests these during the postpartum period, it's believed that it can help to replenish iron and other nutrients that are lost during childbirth, and also prevent depression. But anyway, back to placentas, there's also some women out in the community who are making them into like art and prints and jewelry. I don't really know what I think about this. It's kind of weird. It's kind of cool. It's not cool, but it's just something that's going on more and more. The third is something, this is just kind of erupted over the last 6 to 8 months, but there are a lot of moms out there who have believed that their babies have corn allergies. So it seems to be when the babies are about kind of that normal 3, 4, 5, 6 week fussy, gassy phase. A lot of these moms are breastfeeding, and they're already avoiding dairy and soy. A lot of them are avoiding gluten at baseline and are vegan, and now they're restricting absolutely anything that has corn in it at all. And so I'm a little bit worried just about these extreme dietary restrictions that really have no evidence base at all. And then at the same time, it seems like it's not really helping to remove corn. I haven't met a single mom who's eliminated corn where she's like, my baby's no longer fussy and gassy. The fourth is that lip ties are definitely becoming the new tongue tie. So much so that the pediatric dentists in town who have moms come to them with newborns with breastfeeding problems, who in the past would have lasered the tongue tie, are now adding in the lip tie. Like every baby that has a tongue tie has a lip tie, and they get both things lasered. And there are families that are paying out of pocket like up to $800 for these procedures. So just to be aware of that. And the last is that there's really been this trend like over the last year or two for these infant sleep trainers to move from working with families of like 4, 5, 6, 7-month-olds down to families of the babies that are like 2, 3, 4 weeks old. And this isn't like night nurse coming to help. This is actually, people telling new parents that their babies can and should be sleeping through the night when they're 3 weeks old. And families are paying a lot of money for these consults and services too. So that's just something to be aware of. So you might be wondering, well, this is all fun and dandy that you do these home visits, but how does all of this relate to preemies and neonatology? I always, my big question when I was starting out with this was, do preemie moms even have a 4th trimester? Because a lot of them haven't had a 3rd trimester. They do. Spoiler alert is they do. So I've been fortunate to partner with Project NICU over the last couple of years. They're a local charity that supports NICU families through support groups, care packages, and a lot of parent mentoring. And they were founded by Pam Frasco, who's a mom of 2 former preemies from Avon Lake. As their medical advisor for Project NICU, I've worked a lot on parent education and outreach. I just want to share a few cards that I recently created for a recent social media campaign for NICU families. And they just go through ways to participate in the care of one's baby while in the NICU. So parents have ideas for how they can get more involved. Just quickly, this is a photo of all of us from our big Night for Babies event last year that was like right before COVID hit. And then another member of the advisory board is one of Rainbow, is also from Rainbow. This is Nicole Harvey, who's one of our fabulous nurse practitioners. Other things going on in the community is I've helped 2 local doulas create a breastfeeding support group for NICU moms that's now meeting 2 times per month. And I've helped them apply for a large grant to fund their services. So hopefully there'll be some room for expansion of this. And then through my involvement in the Northern Ohio Lactation Association, I've been able to work with Dr. Ann Witt, who I think I discussed earlier is the founder of the Breastfeeding Medicine of Northeast Ohio Clinic. She's given me the opportunity to work on programming and outreach about the unique lactation and nutrition needs of the NICU graduate. And this is from a talk I gave to them last year. So now we're going to flip from the community setting to what are we doing to support the 4th trimester inside of Rainbow's NICU. Oops. I think it's important to remember that we have a legacy of research into mother-infant bonding here at Rainbow. Both Marshall Klaus and John Kennel, who were pioneers in mother-infant bonding, were in the Division of Neonatology back in the 1960s and 1970s. And Dr. Klaus, whose picture is on the left, was also a huge advocate of both prenatal and postpartum doula care. My co-fellows and I were so fortunate to be introduced to him before he passed away. He came to visit Rainbow when we were fellows, and Richard Martin set up a really special session for us, a Q&A session with Marshall Klaus, which I will always be grateful for. We also have Dr. Lydia Furman here, and she is a pioneer in researching breastfeeding in very low birth weight infants. And she has multiple publications that she did along with Dr. Maureen Hack, who had been my research mentor when I was a fellow as well. And then Dr. Susan Hatters Friedman, who is also here at UH, was actually one of the first psychiatrists to investigate the rates of perinatal mental health disorders in NICU moms, and then offer on-site psychiatric services for NICU moms. And she had been away for several years in New Zealand. And then I think she came back to UH in 2018, like right around the same time that I did. And she's just been lovely to be able to chat with and learn from and work with. So we've had some of the work that I've personally been involved with. Dr. Hatters Friedman and I are both in the UH Maternal Infant Mental Health Interest Group. And this is multidisciplinary. We have midwives and OBs and social workers. And although a lot of our programming and plans have been put on hold during the pandemic, what we have been able to accomplish is that now our NICU moms every Thursday afternoon are able to meet with UH psychiatrists via telemedicine for therapy and support. So there's a very streamlined, easy way for moms who are struggling to be able to get connected with our psychiatry group easily and quickly. The second is that we have a wonderful group of pediatric residents and one former resident who have worked on the creation, implementation, and ongoing analysis of an infant-driven feeding protocol. And the whole purpose of this is so that babies who are preemies who are ready to start to eat get assessed quicker and can start to either breastfeed or take a bottle at an earlier gestational age if they developmentally are meeting certain criteria. And this is a really busy slide, but what I really like is that as they've made our new protocol down in the left, they have specifically targeted, like if a mom is planning to breastfeed, she goes through a whole breastfeeding friendly pathway so that the bottle is not forced on the baby. And then I'm hoping that eventually, as we have residents continue to work on this project, which if you're interested, you can talk to Christina or Adriana, but to incorporate the breast steps in. And this is just a really nice evidence-based way for even small premature babies and moms to get used to breastfeeding. And the 5 steps, I won't go through this whole slide, but they're love, lick, latch, learn, and leave. So I'm hoping that this is one of the next steps of the project. One of our, one of our second-year NICU fellows, Dr. Sarah Jordan Crow, is an up-and-coming breastfeeding medicine expert. She's done a large retrospective cohort study examining the growth and neurodevelopmental outcomes of extremely low birth weight infants fed predominantly their mom's own milk versus predominantly donor breast milk while in the NICU. She presented her research at the Academy of Breastfeeding Medicine's International Conference last fall and has recently submitted an abstract to PAS. And I want to share more, but I don't want to steal her thunder because she's going to be presenting at Science Day in June. But I can tell you for sure that some of her findings will make a huge impact on our current breastfeeding practices in the world of neonatology and really help to target and focus on decreasing racial disparities in medicine. I also want to let everyone know that she has recently been accepted into the Academy's inaugural Leadership Academy, which is starting up this spring. And she's also has created and is implementing a really large QI project in our NICU to help increase the use of mom's own milk. And there's many different, different facets of this project, but this is just one, which is really cool. She's just led, she's created a template for our NICU nurses to use to do like a breastfeeding runs every day. And it's specifically a trigger to make sure that if mom is pumping, that they go through questions every day on supply, how often they've pumped, how much milk is there, and whatnot. So I'm excited to see as time goes by, what happens with our breastfeeding rates. I think that they'll increase. And then this project I'm really excited about. I'm working on it with Megan Cooper Sasse and Carla Phipps, who's one of our nurse practitioners. It's our Locus NICU at Home telemedicine project. And this is a program so that we'll be able to use telemedicine to discharge preemies home with nasogastric tubes and be able to monitor their intake and weight remotely. And we're going to be using the same platform that our pediatric cardiologists use for their single ventricle remote monitoring program. And we have added a bunch of breastfeeding information in as we have customized our software so that we'll be really able to support the breastfeeding moms of babies who are enrolled in this home NG program. So hopefully we'll have more info to present on this once we're finally have piloted it and are up and running. And the last initiative I'm involved in right now is the planning of the Kangaroo Collective. This is a group of former NICU moms who have completed training to be postpartum doulas, specifically for moms of preemies. They're all from the Cleveland area. And once the pandemic is over and the world's opened back up a little bit, we hope to really start to plan how to fully integrate the Kangaroula moms into our NICU and then apply for funding and grants and whatnot too. So just putting a plug for them right now. Overall, I hope with the Kangaroulas and basically like all of these other initiatives is to prevent former NICU moms like this one from reaching out to total strangers on Facebook for support and guidance. To conclude, I would like to recognize all of Rainbow's breastfeeding physician champions, which include Lydia Furman, Kate Griswold, Alyssa, and Ganga from the newborn nursery, and then Sarah Jordan Crow, as I had discussed earlier. Please feel free to reach out with any questions or if you're interested in collaborating on any future projects. Thank you so much.